Okay, I think we'll begin. Hello, everyone, and thank you all for taking the time to join us for our webinar today titled Take Charge of Your Heart. You will hear from the experts at Heart and Stroke Foundation about how to protect your heart and take charge of your health. You'll learn about the signs of a heart attack and stroke in both men and women, key emergency steps that you need to take, and most importantly, how you can stay healthy. Now I'll have the pleasure of introducing our guests with us today, and I'll start with Donna Bedell. Donna is the Manager of Community Programs at Heart and Stroke, a position she's held for 6 years. And Donna knows firsthand through her personal and professional experiences that the work of Heart and Stroke saves lives. Over 30 years ago, Donna's father suffered a near-fatal heart attack, and that firsthand knowledge has given her great insight into how people can manage their health both before and after heart attack or stroke. Donna is passionate about helping to educate people on the importance of creating healthy habits, eating well, and getting plenty of exercise so that they can live long and healthy lives without the disruption of heart disease and stroke. Marlene Peitch has a background in nursing, working in rehabilitation and specializing in paraplegia and quadriplegia. She's had a broad and rewarding career that also included international aviation, event planning, and acting as a spa director focused on implementing medical spa services. More personally, Marlene herself has experienced a major stroke. This incident, as well as caring for a parent with Alzheimer's, has prompted her interest in seniors advocacy, and that brings us to her to us today, where she will share her story and help to provide you with tangible and practical information and tools. We're also joined by Dr. Andrea Moser, Sienna's Chief Medical Officer. Dr. Moser is a family physician with a focused practice in the care of the elderly, a certified medical director, and an associate professor with the Department of Family and Community Medicine at the University of Toronto. She has an extensive background and interest in the care of seniors with a focus on long-term care medicine and has been an advisor to the Public Health Agency of Canada, among other organizations. At Sienna, Dr. Moser is focused on enhancing the medical and physician support provided to our residents. Following a presentation by Donna and Marlene, we'll get into your questions. So throughout the meeting, please feel free to type your question into the chat box at the bottom of your screen. We'll start from the top and try to get through as many questions as possible. So now I'll turn it over to Donna to get started with the presentation.
Thank you so much for that kind introduction, Maureen, and thank you so much to Sienna for having me here today on behalf of the Heart Foundation, the Heart and Stroke Foundation, to speak on this important topic. Can you please move to the next slide? Okay, so today's topic is Protect Your Health, the facts about heart disease and stroke. Next slide, please. So today we're going to be talking about, just at a high level, what Heart and Stroke has done, our vision in terms of what we do at the foundation, setting the stage, where are we today? What are some of the things you need to know? We're going to talk a little bit about heart and stroke and COVID, because I know that's very present for everybody. We're going to look at the signs of a heart attack, the signs of a stroke, what some of those risk factors are, and what you can do to take control of your health to mitigate those risks. I think that's probably the most important thing that we're going to be looking at today. So can you move to the next slide, Maureen? Okay, so our vision at the Heart and Stroke Foundation is a simple one. It is life uninterrupted by heart disease and stroke. And we do that in a number of ways. We fight for prevention, we save lives, we transform recovery, and we invest in life-saving research. Prevention starts early for us at the foundation through our Jump Rope for Heart program, our Heart Smart Kids program, and our Heart Healthy Kids program, where we go into schools and we educate our children on what are the habits they need to live healthy lives. We have a lot of webinars. We do a lot of education out in the community, such as what we're doing here today, to really help people understand what their risks are and what they can do to help. We educate over 300,000 people every year on CPR through our CPR program. We advocate for people at the provincial and federal health levels, whether it's through, the National Pharmacare program, new laws against vaping, which has become the new smoking, all sorts of things. We transform recovery through our partnerships with the Stroke Network, Stroke Best Practices. We recently announced a partnership with the March of Dimes Foundation on stroke recovery. And perhaps most importantly, we do invest in life-saving research that has changed the lives of Canadians over the last almost 70 years. So in that time, we've invested over $1.52 billion in research. And that has resulted in a 75% decline in heart disease and stroke mortality rates. Currently, we have approximately 800 researchers across the country that are funded by heart and stroke research dollars. Next slide, please, Maureen. Still, though, despite all that success, every 5 minutes in Canada, someone dies from heart conditions, stroke, and related diseases. This outpaces other diseases by a considerable amount. In fact, 13% more people die of these diseases than from all the cancers combined. And together, these diseases are the #1 cause of premature death in women in Canada, and they have an enormous economic burden, costing our economy at least $24.8 billion every year. And 90% of people in Canada have at least one risk factor for heart conditions or stroke. But as you're going to see later on in the presentation, there is much that you can do to prevent that. And that's really what we're going to be talking about here today. Next slide, please, Maureen. So I'm going to switch gears a little bit and talk just a little bit about COVID, and because I know that's on everybody's mind, and there's a few things that we at the foundation really do want people to understand and know. And first off is that heart attacks, cardiac arrest, and stroke are medical emergencies. And that means that you need to call 911 if you're experiencing some of the symptoms that we're going to go through later on in the presentation, and get yourself to a hospital, because immediate medical attention really does help health outcomes. And the reason why I'm telling you this today is because initially, when in the first 3 or 4 months of COVID, what we saw was a 30% decline in people presenting to emergency rooms with the signs of a heart attack or a stroke. And that was not because there was a 30% decline in people having heart attacks or strokes. It was because people were afraid to go to the emergency room. Now, that's normalized a little bit, but what we're still seeing is that people are presenting to emergency room at later stages of these diseases. And that is a problem, because that severely will affect outcomes. So it's really important, if you are experiencing some of the signs and symptoms that we'll go through later on in the presentation, that you do get to a hospital. They're set up to care for you. They can care for COVID patients, and they can care for you in emergency, and that can be done safely. So I'm here to really drive that message home, that you need to get yourself to an emergency room. Also, it's very important that we, follow health guidelines and take care of ourselves. People with underlying medical conditions like heart disease or stroke and their associated risk factors are at higher risk of serious complications from COVID. And so examples would be, if you have hypertension and you contract COVID, you have a 2 times higher risk of serious illness or death. And if you're living with heart disease, you have a 4 times greater risk should you contract COVID. So it's really important to follow public health guidelines. I know it's been a long COVID season, I get it, but it is important to kind of stay the course and do what we can until we get through this. And the next point, it's been a difficult 15 months. I get it. It's hard not being able to see the people that you love in your life on a regular basis. But physical distancing doesn't mean social isolation. And particularly what we see with seniors is, we've seen that from a mental, physical, and emotional well-being perspective, it's really important to connect. We are lucky, we're connecting right now. We have the tools at our disposal that help us to do that. Whether it's picking up the phone and calling a friend every evening, or calling a family member, whether it's, FaceTiming with your grandchildren, whether it's doing, a virtual book club, which is something that I love to do and continue to do on a personal level. but it's really important to try and connect however we can. It's going to keep us healthier. It's going to keep us safer. You know, it's really important to make sure that we keep doing that. Also, early on too, there were some reports that some heart medications increase the risk of COVID-19, and that is absolutely not the case. Nobody should be changing their medications without consulting their physician. It's really important to understand that there's a lot of misinformation out there, and nobody should be making those changes without consulting their medical practitioner. Also, from a rehabilitation perspective, if you are in a rehabilitation program, that should continue. Again, it can be done safely, and there are lots of virtual rehab programs in place to help with that. And lastly, and again, to reiterate, preventing heart conditions and stroke and managing your health are more critical than ever. And you know, that's really what the next parts of this presentation are going to be. And that's really going to help overall with managing our care through COVID. And it's really about, you know, taking the steps that we need, listening to public health, and taking some of the steps that you're going to see later on in the presentation to help manage your health. And without further ado, I'm going to turn it over now to our lovely volunteer, Marlene, to take you through the next parts of the presentation. Thank you so much.
Thank you, Donna. I'm going to be covering the signs of a heart attack followed by stroke. So Maureen, could I have the next slide, please? All right. The signs of a heart attack are no longer the classic signs that we all knew in years gone by. Now it's classified as chest discomfort, not a sharp pain, because in recent studies we have found, or I should say, the research team has found that women have vaguer symptoms. So we're saying chest discomfort, pressure, squeezing, a fullness, or a burning sensation. This is also quite vague, but really this could be a heart attack in a woman. Sweating, perspiring profusely, quite common. Upper body discomfort, neck, jaw, shoulder, arms, back. Years ago at the Winter Olympics in Vancouver, a girl who was skating in the freestyle, her mother, along with her and following her career closely, died the night before. They found in her bag a note: sore jaw, blurred vision, swollen fingers, must see a doctor. She died of a massive coronary, had heart disease, and didn't know it. She was very busy looking after her daughter's career. And this seems to be a gender situation. So pay attention: neck, jaw, shoulder, arms, back, unusual pain. Nausea. They often feel like vomiting, and indeed do. Shortness of breath. Lightheadedness, very dizzy, out of phase. Also, it's quite common, person having a heart attack may be in denial, may think to themselves, I have everything under control. This is quite common. Next slide, please, Maureen. All right. There's a difference between a cardiac arrest and a heart attack. A heart attack can lead to cardiac arrest. They're two different conditions. In a heart attack, heart's still beating, blood is flowing, the person is still alive. They often can tell you what the problem is. In a cardiac arrest, the heart stopped beating, blood stopped flowing, and the person does not respond. The person is dying. You have just a few minutes to get the heart going again. Next slide, please, Maureen. All right. Hands-only CPR. I'm sure many of you had cardiopulmonary resuscitation, CPR. What you should do first is phone 911 and shout for an AED. Those of you working in business offices, in retirement homes, all of the public facilities, gyms, libraries, all have an AED. And with the AED comes training. You are paying for the training, not the machine. So don't delay, act. 911, get help on the way, and shout for an AED. Now, if no one is around, you have to use your mobile phone to do this, to call 911. Put it on speaker mode. Push hard and fast in the center of the chest. This is applying CPR. If you haven't had training, many of you will remember a commercial years ago put out by the Heart and Stroke Foundation. The music was Staying Alive by the Bee Gees. Very fast, 100 to 120 beats a minute. So don't stop until help arrives or the person begins to respond. As you know, first of all, you would say, can you breathe? Can you talk? If they're unresponsive, this is when you start to apply CPR. This can be very, very tiring. Get backup help if you can. I've been in a situation transatlantic, and believe me, keeping CPR going for 3 hours needs a change of hands. It's very tiring. And if an AED is on premises, then you would have it available to you. If you haven't had the training, they're very safe, they're very simple. You open the container, there's a big button that tells you to press here, and a recording will tell you exactly what to do. It will not allow you to shock a person if they have a pulse. All right? If you see somebody collapse or they're unresponsive, you can save their life by using your phone, your hands, and your wits. Don't hesitate, even if you're afraid. We're all concerned. We're all apprehensive. I know I am, but you can only help. You can't hurt that person anymore. Don't be afraid. Signs of a stroke. All right, it's a medical emergency. If you experience any of these signs, 911. Do not drive to the hospital. An ambulance will get you to the hospital for stroke care, the best hospital. Every hospital has a specialty. One is for spinal cord injury, one is for stroke, one is for heart disease. Now, these are the signs of a stroke. Face. Is the face drooping? If it seems asymmetrical, ask the person to smile if they're conscious. I saw a new memo that if you ask them to stick out their tongue, it might be lolling to one side. I've never tried that. But, arms, can you raise both? That is to say, if you raise your arms to the side, close your eyes. If you're having a stroke, one arm will drift down. Speech, is it slurred or is it jumbled? Time. Time is of the essence. You call 911 right away. And be prepared that the person having the stroke may be in denial as well. I know I was certainly. I said, wow, why didn't you look at that? I'm talking like a golden retriever. And look at my coffee is splashing when I put the cup back on the saucer. And I just thought it was a lark. Maybe I'm having a stroke. But as I said, my left brain was flooding with blood. My right brain was in Nana land. And luckily, in my case, my husband said, we're going to the hospital now. And we did. So be prepared. They may be in denial. Next slide, please. What are the risk factors for heart disease and stroke? Prevention is the key. So prevention starts with knowing your risk. 9 in 10 Canadians have at least one risk factor for heart disease and stroke. You don't inherit the risk factor, but you inherit the predisposition for it. Almost 80% of premature heart disease and stroke can be prevented through healthy behaviors. Habits like eating healthy, being active, living smoke-free, and they will have a big impact on your life. Very difficult to give up smoking. I have a daughter who smokes. She happens to be a singer. And you'll find that in that milieu, a lot of entertainers smoke before a performance. It's very difficult, but there is help for that. Next slide, please. Age. The older you are, the higher your risk. Sex. Women's risk increases after menopause. Family and medical history. Close family members who've had a stroke increase your likelihood to having a stroke. And women who've had preeclampsia during pregnancy are also at risk. As I said, you don't inherit the disease, you inherit the predisposition for it. Southeast Asian and African heritage are more likely to have high blood pressure and diabetes. Indigenous heritage, they're more likely to have high blood pressure and diabetes. In fact, in Canada, the Indigenous women have the highest chance of having a heart attack. All right, lifestyle risk factors. An unhealthy diet. We all know this is part of the reason. There are so many choices you can make today about your diet. One of them is having, at least half of your plate with vegetables, the other half meat. We no longer eat a 16-ounce steak comfortably. Physical inactivity. Very difficult when somebody is in a wheelchair or they're very elderly, but there is activity for you. There are wheelchair exercises, there are wheelchair yoga. People who are in a home, walking around the residence inside, especially in the winter, is an activity. It's not the time taken, it's the distance covered that's important. So they may start with baby steps. It's not realistic for everybody to quickly buy a gym membership. But for example, if you live in a high rise and you're doing the laundry in the basement, set the elevator for one floor down when you're coming upstairs. Climb the last flight of stairs if you're able to. Maintaining an unhealthy weight. And this is true. We have a huge problem today, and part of it maybe could be COVID, but there is a trend in obesity. Unhealthy weight, it should be weight in proportion to height. Now, this does not mean you have to be really thin, but paying attention to your weight, this does have a stress on your body. As I said, smoking. Smoking can lead to so many things, including COPD, chronic pulmonary disorder. It will shorten your life. There is no doubt about that. So if you can quit. And Heart and Stroke has systems for you too. You can have help. There are webinars. There are all sorts of helpful institutions out there. And your laptop. And stress, well, that is huge. As Donna said, COVID has added extra stress, but everyone has stress. When I present to seniors in residence, I often do, people will say, what have you got to have stress about? Well, if they have children, they're stressed about their children's future because there is no company offering a massive pension. Most jobs as graduates leave university are often contractual. There is no certainty in that. And I think a lot of seniors are afraid they can't support their children. Especially if you are living in a residence, I encourage everybody you have fellowship there. You go into a home for safety and a social life. And although everybody is very shy when they come in, they're there because perhaps because a spouse died, that's frequently the case, and they're alone. They're lonely. So make an effort to speak to people. And if it means you're stressed at home, call somebody on the phone, talk to somebody. Everybody has a concern. If you're worried about something and you're living in a home, have a cup of coffee and talk about it. Catharsis is the best thing for you, getting it off your chest. The other thing is recognizing what the stress is. It may be deep-seated, so you would seek some professional advice. Excessive alcohol and drug abuse. Well, this is a huge problem today, as you see by the statistics in the news. And excessive alcohol is, and these will shorten your life. There is no doubt about it. But here too, there is help on the way. And very many institutions you can seek help from. And when Maureen changes the slide now, you'll see what's considered an excess. So get healthy and healthy eating. Eating a healthy, balanced diet is one of the most important things you can do to protect your health. And a healthy diet's made up mostly of whole or natural foods. So this includes eating lots of vegetables and fruit, choosing whole grain foods more often, eating a variety of foods that contain protein. You have, for people who are vegetarians, all vegetarians know that quinoa is the highest source of protein in a grain. So it doesn't have to be meat per se. You can eat fish, but source out all these ancient grains are absolutely wonderful for you. I grew up in the Midwest, we're meat and potatoes country. A steak was a sign of success, and all vegetables were preserved in the fall. We didn't have fish flown in, and I always thought that fish came in blue boxes in the freezer section of the grocery store. And we know that's all available to us, and with the great influx of different nationalities, we are exposed to more foods than we ever dreamed of. I never saw an avocado till I was 21. And now you can go into a restaurant and they're serving mashed avocado on toast as a very sophisticated starter. Well, any West Indian I ever presented to has told me that was their breakfast. That's what they ate in the morning. So they are exposed to all these wonderful foods that we never knew existed. But they're there, and they're there for us now. And I can have multiple chefs on television from every walk of life in every country showing us how to eat the way they do and what is also very healthy for you. So we're going to avoid highly processed foods. You've got choices when you choose oils or your foods. Look at the labels. Heart and Stroke is instrumental in putting guidelines on the back of all the containers of bread, for example. You can see how much salt there is in that loaf of bread. Shop and compare. Choose the one that's better for you. And avoid sugary drinks. Right now, you will see, even in the stores, you will see soda water that is fruit flavored. You will see so many drinks that are based on fruit instead of just sugar water. But make those choices. The best choice of all is always H2O, water. But drink as much water as you can during the day. Hydrate your body. It's very, very good for you. Thank you. Get healthy and stay active. 150 minutes of physical activity per week. Now, depending on your age, that may vary. Not all of us can get on a bicycle. Not all of us can jog. But we all can walk or exercise our upper bodies. So, before, even as a child, I had to get up and cross over to the black and white television to change the channel, and indeed even turn it on and off. Now we have remote controls for everything. Why, my husband can start the espresso machine from his bed with his phone. He can put on the alarm for the house, turn everything off and on. And I said, you're missing something here. You exercise yourself by doing these activities on your own if you can. So our life has been made easier by all these appliances, but we are not exercising our bodies as much unless we make a conscious effort. I'm at current time looking after two neighbors, one who was critically ill and one who sustained a great fall. She has a beautiful golden lab, and I am walking him twice a day, I'll have you know. And during COVID, more people are buying pets. Indeed, you see them walking every morning. You're meeting neighbors just walking a dog, which I haven't had in recent years. And it's been exhilarating for me and also very healthy. So there are all sorts of activities that you can do. As I said, walking up and down stairs, if they're presented to you, if you can. But before you embark on any active program, before you contemplate walking or running the Boston Marathon, consult your caregiver and find out what would be appropriate for you. That's key. And if you're short on time, remember that any physical activity is better than none. A little 10-minute exercise is fine if it's all you've got to spare. Rather than saying, what's the point? Any activity is better than none. However, the more active you are, the greater the health benefits, always, always. This can mean walking with a partner in a long-term care facility and walking. I know before COVID came down, several malls are open very early in the morning, and this enables seniors who've come perhaps in a van from their retirement home to the mall wearing sneakers, and they walk around the mall. There's nobody there to bother them. It's perfectly safe. They will not slip or fall. Indeed, under normal circumstances, there are rest stations. There are benches and chairs throughout. And I know of one particular mall that has a security system. If you want to, it's entirely your business, but you can register with your name, any physical condition you have, and a list of your meds, so that if anybody has to call 911, they have information to give the paramedics. So that's a very good thing. There is help for people at any age that they are. One thing I forgot to mention to you as I was talking about 911, if you are in a situation where you feel you are having a heart attack and you call 911, be sure to unlock the door. That is key. You're wasting many minutes of time because the paramedics will not break down that door without trying another window. Now, what the dispatcher will often do is say, are you alone? Is anybody there with you to help you? If that is not the case, often the paramedics arrive with a fire truck, and that is the reason. They will try any way in the house to get in first. They don't crash and burn like you see in the movies. So give them access, save time. And if you're having a heart attack, chew an aspirin. Put it under if it's an enteric coated aspirin, those little low dose aspirins, swallow it. And you might be more comfortable sitting up than lying down. Sit where you're most comfortable, but make sure the door is unlocked. So back to getting healthy and healthy weight. Managing your weight doesn't have to mean altering your life dramatically. So let's take baby steps. Let's aim modestly, realistically, and then build from there. You may decide that you're going to substitute a fat milk for a low-fat milk. Growing up, there was only milk. For me, milk was delivered by the milkman. And in the wintertime in Manitoba, there was usually about a 1-inch cap on the milk, and that was the fat that had gone to the top. But we didn't have 2%, 3% skim milk, no fat. We didn't have that. Today, you have choices. And don't go on a massive, extreme diet without consulting your caregiver. And those diets are meant to be done for 2 weeks only, and then your body will plateau, and you may do it more harm than good. So consult your caregiver. So be realistic. Don't aim to lose 30 pounds in 2 weeks. No, make it long term. Don't weigh yourself every single day and fret about it, because water can put weight on you as well. Focus on small, steady weight loss, as I said. And research shows that you'll be more likely to keep it off that way. So rather than embark on an extreme diet, do a life shift, change your lifestyle, modify it, eat healthier foods. So you can achieve and maintain a healthy body by eating healthy and staying active. That's the bottom line. That's it. Thank you, Maureen. Smoking and tobacco. Smokers are 3 times more likely to have a stroke or die of heart disease. This is very dire. It's very dire, but it's true. So to successfully quit smoking, you need to address the physical addiction and the psychological habits that go along with it. People smoke. Maybe they start because their friends are doing it. Maybe they think it's more sophisticated. But it can become a physical addiction. And there is a psychological attachment. We know that. Ask for help. Set a quit date. Have a plan for the challenges you'll face while quitting. And understand your triggers and be prepared to manage or avoid them. Make your home and car tobacco-free zones. More and more you'll see people standing outside a building and smoking. Even at hospitals, they're now not allowed to smoke outside the door. They must go beyond the premises. They've got stations out there. It's becoming more and more awkward for smokers to smoke, I have to say. In restaurants, there are no longer smoking sections. Indeed, on aircraft, there are no longer smoking sections. It used to be that if you gazed from the front of the aircraft to the rear, all you saw was white smoke. And now that's gone. So our government's taken hand in this too. Ask for help. Set a quit date. Have a plan. Make your zones smoke-free and know your triggers. So myquit.ca and smokefree.gov, these will offer you a personalized quit plan that can help deal with the emotional and the physical aspects of quitting. Thanks, Maureen. Get healthy, reduce stress. Stress busting tips. So, as I've said, figure out what's causing you stress. Is it your family? Is it fear of mortality? Is it fear of being alone? There are so many things that are causing stress today. And anxiety is increased by COVID. As you know, the psychologists and psychiatrists are slammed. There's been such an increase in people seeking for help. Be physically active, do what you can. Share your feelings. As I said, pick up the phone, talk to someone, have a coffee with someone, even remotely. Take time for yourself. Very often, caregivers in particular are taking no time for themselves. They're looking after a loved one. I know of 2 people who died of heart disease looking after their very ill husbands, and they preceded their husbands in death. Pay attention to your body. Listen to your signs. But take time for yourself. Make time to laugh. Watch a comedy. Don't watch those morbid shows on television. They can be very upsetting. So make time to laugh. Eat well and take your vacations, or in this case, your staycation. Have a picnic in the yard. Have time with yourself and your family. Thanks, Maureen. Alcohol. Now, too much alcohol can increase your blood pressure, increase your risk of heart disease and stroke. So if you drink alcohol, you limit yourself to no more than, in women, 2 drinks a day, most days, to a weekly maximum of 10. And men, 3 drinks a day, and most days to a weekly maximum of 5. Now, there's a discrepancy here, and I think it's based on the size of men as opposed to women. A standard drink is would be a 12-ounce beer, that's 5% alcohol, and for wine, a 5-ounce glass. Now, not the big 11-ounce schooners, the 9-ounce schooners, but 5 ounces. And spirits, 1.5 ounce, which is 40% alcohol, and that's one shot, 1.5 ounces. And I cannot see the bottom of the screen.
I think there's a link to the Heart and Stroke site.
Oh, would you give the link
Yeah.
out?
Yeah, I can include it. Oops, I moved to the next slide, but I can include the link later in the chat.
Thank you. Recreational drug use. So using these recreational drugs can increase the risk of having stroke. We all know amphetamines, cannabis and marijuana. This is true. Donna's touched on vaping even. This is still under study. I know there is medical marijuana available. It is controlled, but I have no idea what the results of that is. They're feeling they do or do not work. I do not know, but there is something showing in the research that is ongoing that there is some effect to heart disease. Cocaine, ecstasy, heroin, and opiates. And aren't opiates in the news today? An increase in 25 to 45-year-olds, I heard today on the radio. And COVID is at the bottom of this too. Lysergic acid diethylamide, LSD, those were the trippers, and PCPs, all of them very dangerous, all of them life-threatening, and all of them increase the risk of having a stroke. Your risk of having a stroke is 6 times higher in drug users than non-drug users. And convincing people of that is difficult, but we aim to do it. In many cases, when a stroke occurs, it happens within hours of drug use. Thank you, Marlene. So we are done. For more information or to donate, please go to www.heartandstroke.ca. Thank you.
Thank you very much, Marlene. Donna, was there anything else that you wanted to add before we move into questions?
No, again, what I would say, if you can hear me, is really just to reiterate that people, take control of your lives. I think one of the things that I really do want to reiterate is so much of we don't realize that by making small changes to the things we do on a daily basis, if you do it consistently, that can have exponential changes in your life. And I think often what happens is we are human and we often expect or we want quick fixes to things. So we'll make a change to our diet as an example. And because we may not see an immediate change, we think, oh, well, this isn't working. But in fact, if you keep doing it on a consistent basis, you're going to see that change. It just may take a little bit of time. And that much of what we've shared with you today really are things that you can control. And I think it's really important to kind of take those little steps to live a healthier life. It affects you not just physically, but emotionally and mentally as well. We're one organism and it really does help. The other thing I would say to you also is, if you take nothing away from this presentation today, the signs of a heart attack and the signs of a stroke and the fact that those are medical emergencies and you really do need to call 911. That's very important. And like I said, we've seen a decline in people presenting to emergency rooms, and that is not a good thing. And I just again want to thank Sienna for the opportunity. And now I think we're open for questions and more than happy to answer questions that people may have.
Great. And Dr. Moser is also here to support responding to some of your questions. So, and as a reminder, you can type your question into either the Q&A or the chat function, and we can take them from there. So the first question is, first of all, thanking you, Marlene, for sharing all of that great information, and wondered if you could repeat the tip about the aspirin under the tongue. Do you mind?
Right. So if you feel you're having a stroke, no harm done. If you have aspirin on hand, take one and swallow it. If it is an enteric-coated one, the little blue ones with the hard coating, this is to protect your stomach, so you don't have time to wait till that dissolves. Chew it, chew it. And they even have now, I believe, aspirin that is almost an instant dissolve that goes directly under the tongue anyway.
Marlene, I think you meant heart attack. You said stroke inadvertently.
I'm sorry.
I think there. Yeah.
I did.
Okay.
I did. I'm sorry.
Good.
Heart attack. Yes, a heart attack. And I meant what I said. I've been in a situation with a patient, and sometimes they're in denial, but be proactive. Give as much information on to the chat with the dispatcher, because you may think that she's sort of stalling and delaying. No, she's gleaning as much information, she or he, as they can, whilst the ambulance is on its way already. The minute you give the address, it's on its way. But the paramedics have to know what they're walking into. Is this somebody having shorter breath because they're having an anxiety attack? It could be something more dangerous than that, but they have to have as much information on hand. And sometimes you can give them that information.
Great, thank you. Dr. Moser, is there anything you'd like to add to that?
No, just to reinforce that if you crush that aspirin, it's going to get into your bloodstream faster. So whether it's, coated or not coated, you can even take 2 spoons like we used to do for our children and crush it up and, take it. So that's just important. And don't delay, right? Don't be fiddling around with going to seeing if you have aspirin in your cabinet or not. Call 911. And while they have you on the phone, they'll talk you through that. Do you have any aspirin? So they'll walk you through all of that. And really that is your first line, is to call them, because once you have them on the phone and they have your address, they're dispatching somebody to come to your home. So all those other things you're doing in addition to.
Okay, great. The next question comes from Denise. Does long-term usage of antidepressants affect the brain for an increased risk of stroke?
I can answer that, or try to answer that. Sure. Again, if you're on antidepressants in conjunction with your doctor and that's what they're telling you to do, then that is absolutely the right thing to do for you. I don't actually have any research right now that I can put my hands on that would talk to that. So I don't know. In terms of what we were talking about on the slide, that's what I am aware of from a heart and stroke perspective. So I don't know if Dr. Moser has anything to add. But again, it's always about following the advice of your doctor with taking any of these types of medications. And that would include, for example, medical marijuana, right? I will say, like, with regard to that, there is no definitive research that we have available to us right now that talks about that. We have seen that if you're using marijuana on a regular basis and it's not controlled, we do see an increase in arrhythmias, but the research is still new, and there's funded research out there that we're still waiting to get the results of. We do everything we do really at Heart and Stroke is based on the science. And so we don't like to talk about things that we don't have science to back up, anecdotally. But I will ask Dr. Moser if she can add anything to this question.
Sure. So it's certainly not something that's common. And, there are a lot of other very, very significant concerns of untreated depression. Particularly in this day and age that we're in right now, right? Like, we know how difficult this year has been. And we know, I think on the news the other night, they were even talking about how many Canadians are suffering from at least one symptom of depression through this pandemic. So if you are, being treated with an antidepressant, then absolutely don't play around with that, and talk to your physician. If you're concerned, then reach out and speak to them. And I think that's one of the things that I think really struck me during this last 50 minutes listening to Marlene, and an excellent presentation, is just really engage with people. And it's very hard when we're all isolated, but stay engaged, stay connected, check on those neighbors, check on family, stay connected with your primary care provider. And they have a lot of resources. And this may be a time when you're saying, boy, this is maybe an opportunity for me to get on top of my nutrition, on top of my health. And how can I reach out and get some support for that? And even with nutrition, a lot of family doctors now are part of family health teams, and they have a nutritionist that they work with on their team, or the heart and stroke. So there's just so many people that can support you, and it's taking that time to reach out and say you're ready for things. And it is incremental, little tiny changes that can have such a dramatic impact on our lives.
Thank you. The next question comes from Linda. What if you take, I think it's pronounced Xarelto? Should you take 81 milligrams of ASA? I think she's talking about if she's experiencing a heart attack. It's a very specific question. I don't know, Dr. Moser, if you're able to respond.
Yeah, I'm not
that.
able to, because that's very specific in terms
yeah.
of your. So I would actually, that would be a great question to ask your doctor, because again, Xarelto is prescribed for many different reasons and at different doses. So check with your doctor and say, hey, I attended this webinar by Heart and Stroke, and they were talking about taking an aspirin if I was having symptoms. What does that apply to me because of the Xarelto? So any opportunity you have to review your medications. You can also even ask your pharmacist that's prescribing. They can do something called a meds check if you live in Ontario, and I'm not certain about all the other provinces, but the pharmacy will also go through with you and tell you whether or not other medications would be safe.
Okay, thank you. From Diane, also a question, what is the percentage of having a grandparent and parent who had heart disease later in life? And does this affect me genetically in raising the risk? I think you spoke to that. Oh, sorry, go ahead, Donna.
No, I was going to say, yeah, as Marlene had said earlier, while it doesn't necessarily guarantee you, or it's not genetically passed down, there is a genetic predisposition that does raise your risk. So in my case, as an example, my father has heart disease, and stroke runs on my mother's side of the family. Actually quite prevalent, and we've had younger, like people my age, like I had an aunt who died of a stroke at my age, and my dad had his very, very, very severe heart attack at 55. So as a result of that, I really do try and manage my health, and I've always made that a priority. So I try to do all the things that I can to try and mitigate that risk. Well, I say I've always made that priority. That's not true, because I did smoke at one point, and I always say to my children, the greatest gift I ever gave myself was quitting smoking. I still stand by that, and that was a lot of years ago. So it does raise your risk, but it's not something that's passed down through the genes. That being said, interestingly enough, Heart and Stroke is funding research that's looking at genetic markers for heart disease and stroke to see are there markers that would give us a better indication if somebody is more likely to have that happen to them. So there is research currently being funded that's looking at that both for stroke and for heart disease. So it is something that we are aware of, but today it just shows that there's a predisposition. So again, it means that if you're aware of that, take care, right? And do the things that you need to do to really kind of manage your health. And it's frustrating sometimes, like for me, I was told I had to take cholesterol medication, and I was like, what do you mean I have to take cholesterol medication? And I resisted it. My doctor very kindly said to me, this medication is available to you for a reason. And, it's not some kind of weakness that you need to take it. And so dutifully every evening I take my 10 milligrams, and now I've learned to it makes me feel better. I think, okay, I'm being protected. I'm doing what I need to do to take care of my health.
Great, thank you. And there's a comment and then a question from Lynn. Her comment is pointing out before she was diagnosed with mini strokes, the doctors thought it was quote unquote just stress, and was most frustrating and delayed her treatment for over 2 years. So I don't know if related to that, Dr. Moser, you would have any advice on being persistent or advocating for your care?
I just think we all know our bodies, and if
Yeah,
you feel there's something and it just doesn't feel like the right answer, then ask and ask again. And it's okay to have a second opinion. You know, your health is what matters. And if you really feel there's something off and it's just not, but the answer you're getting just doesn't seem to sit well with you, then please don't give up, and ask again. Donna's going to jump in.
Yeah, interestingly, there is research, again, funded by the foundation, and it's recent, that shows that for women, TIAs may actually be a full stroke. So it's interesting because these mini strokes that people are experiencing can be different in women and can actually be more of a fulsome stroke. And this is actually quite groundbreaking, and there is still more to come on this, but you know, we are looking into it. And I think that's the other thing with both heart disease and stroke. Sometimes for women, it presents differently and they're not taken as seriously. And unfortunately, I mean, this is kind of the socialization we have in society. So this is not just a medical care issue. Sometimes we're all socialized in a specific way. And I would say for women in particular to really kind of advocate for themselves, because they often will get lesser treatment and it is frustrating. But to Dr. Moser's point, we know our bodies and it's really important to be your own best advocate.
great, thank you. And Dr. Moser, are you able to answer Lynn's other question, which is it true that you get faster treatment if you arrive in an ambulance at emergency? At times she has walked because she lives so close to the hospital.
This is a great question. And yes, you get faster treatment because the treatment starts when the ambulance arrives. So they triage, they come, they assess you, and then they determine the level of severity, and you get to the ambulance. You get to the hospital faster, and they're often ready for you when they arrive. I've had experiences in my own family were it not for the ambulance, that person would not be with us today. So it is that fast response, and it is that triage on site. They do that assessment, they connect with the hospital, they determine which hospital is best for you to go to. And if you're walking to a hospital on your own, nobody knows why you're going, something might happen en route to the hospital, and there's no paramedics there for you. So I would urge you all that if this is happening, please call the paramedics, the 911. That's what they're there for, and they will help you and support you and do what you need to do. Great question.
Thank you. So that is the end of the questions that we currently have, and we're at the top of the hour. I just wanted to first point out, I did put into the chat box there the link to the place on the heartandstroke.ca website where all of the risk and prevention information, and specifically the lifestyle risk factors that Marlene went through. That's the direct link to that section. So you can find more information there and reinforce some of the learning that you've had today. So I just want to thank everybody for being with us today. Thank you to all of our panelists, Donna, Marlene, and Dr. Moser. It really was a great and informative session. And I don't know if anybody has any closing remarks you'd like to make, but I think that we've had such a great afternoon, a great hour with all three of you.
I would just add to Donna's comment on the COVID and complications. If you haven't had your vaccine, please find where you can get it and go and get it. It is just a lifesaver for us on this. And I think, Marlene, you had something to say. Sorry, I jumped in there.
Oh, no, not at all. Not at all. No, I'm in full agreement with you, as particularly with the hospital. You know, those paramedics are amazing. They're highly trained. They come in, they start an EKG, one will start an IV right away. They triage you on site. So cut to the chase, get to the hospital in an ambulance. You'll never regret it. This is the greatest country to live in. It's
Thank you. Yeah. All right. Thank you again, everybody. Enjoy the rest of your day. And if you, hopefully you have the amazing sun that we are having here at the moment. And we look forward to seeing you on another webinar sometime soon. Take care.
Thank you.
Thanks so much.